Hello, this presentation will be about diabetes mellitus by Renee Polina. Okay, first off, let's break down the word diabetes mellitus. In diabetes, the word dia means through, and the suffix betis means to go. So together it means to go through. Other meanings for diabetes are like a siphon, and this is because of diabetes having the characteristic of excessive urination. Mellitus is a word that means honey or sweetened. So the disease diabetes mellitus is regarding sugar and has the characteristic of excessive urination. To understand how diabetes works, we need to first understand how food turns into energy. First, we eat and the food gets digested in our stomach. The food is then converted into a sugar called glucose. Meanwhile, the pancreas makes insulin, and insulin's job is to move glucose from the blood into muscle, fat, and liver cells to be used or stored as fuel. People with diabetes have trouble moving the sugar from the blood into these cells, and their liver makes too much glucose and brings it into the bloodstream. This can be due to the pancreas not making enough insulin, the cells are not responding to the insulin properly, or both. There are two types of diabetes mellitus. Type 1 diabetes can happen at any age, but is more common in children, teens, and young adults. In type 1, the body makes little to no insulin because the pancreas cells making that insulin stops working. Therefore, daily insulin injections are a must. Type 2 diabetes occurs mostly during adulthood, but still affects teens and children. The pancreas still produces insulin, but the body is resistant to it and doesn't use insulin as well as it should. You are more prone to type 2 diabetes if you live a sedentary lifestyle, poor diet, and have excessive body fat. When diabetes is not properly controlled, blood sugar levels rise and symptoms occur, such as blurry vision, excess thirst, along with frequent urination, increased hunger, fatigue, and sudden weight loss. In the Middle Ages, diabetes was referred to as the pissing evil due to the constant urination. Type 2 diabetes develops slowly, as well as the symptoms. However, type 1 diabetes develops quickly due to the total lack of insulin in the body. If the disease is not treated, the constant excess of glucose in the blood will cause problems throughout the body. Eye problems from light sensitivity all the way to blindness. Any wounds occurring will have trouble healing, may get infected, and lead to an amputation of the leg or foot. Nerve damage causes pain, numbness, digestive problems, and erectile dysfunction. The kidneys filtering the sugar in the blood will also be affected and can cause kidney failure. Many people with uncontrolled diabetes end up with renal failure and have to go through dialysis. The immune system is weakened, making the body prone to infections. The diabetic is also at risk for heart attacks and strokes. Type 1 diabetes has no cure, only lifelong medical therapy and managing of the sugar levels to prevent symptoms. Type 2, on the other hand, is reversible through drug regimen, diet, and exercise. Proper blood sugar monitoring is essential, and educating people on proper nutrition is important. Exercise as much as possible to use the energy that comes from the food you eat. For those who are not diabetic, prevention is key through lifestyle changes, eating habits, and maintaining a healthy body weight. Diet for the diabetic consists of lean protein sources, mostly non-starchy vegetables, and some grains. An example would be a lean chicken breast, a fresh kale salad, and a half a cup of brown rice. The main thing about being a diabetic is controlling carbohydrates. Rice, pasta, and noodles are the most calorically dense carbohydrates, thus it is best to eat very little of these. Avoid sugary fruits like mangoes, oranges, grapes, and apples, and only eat them in moderation. Make sure to exercise to burn energy consumed like weightlifting or cardio such as running or swimming.